Meanwhile, the National Primary Healthcare Development Agency has announced the expectation of more COVID-19 vaccines into the country. They include the Oxford, AstraZeneca, Moderna, Pfizer-BioNTech and Johnson & Johnson vaccine shipments in the coming months. According to the breakdown, the AstraZeneca is expected early July and August, was donated by COVAX. 4 million Moderna vaccines are expected in August by COVAX as well. 3.6 million Pfizer-BioNTech donated by COVAX as well, and 29 million Johnson & Johnson doses expected by September, donated by the African Union. Dr. Gemiu Janiu, a public health physician, joins us now for more on the situation of COVID-19 in the country. Thank you for joining us on the program.
Thank you very much.
First, I'd like to get your thoughts. I mean, the University of Lagos and the measures they've taken, some have argued that perhaps when they realized they had a first case of COVID-19, the precautions and the measures should have been taken initially, not until, having multiple cases. What's your take on that scenario?
Okay, thank you very much. I think based on my experience and my thinking in line with the management, I think they acted well, thinking that it can be managed. Before now, the protocol, as if that a school or an institution should have a kind of organization and organize it in such a way that they can also, manage a certain number of cases, maybe having an isolation area, and trying to manage mild to moderate cases. In the event that they have a severe cases, they will just link it up with the Lagos State government. I think they try to salvage the situation, but as the cases continue to increase, they have no choice than to, because I think they actually took a decisive action, because if the whole thing gets overwhelming, the school may not be able to handle it, and nobody wants to risk his or her students, dying from this from the virus. So I think the best approach is what they have just done, that everybody should go home. Because this virus thrives where there are clusters, and the nature of our hostels, you can see like 10 or 15 people in a room. I think the best way is what they have done to reduce likely transmission of more of the virus among the students. Sorry, they may feel the pain, but I think the institution actually took a well-decisive action just to save them from getting infected with the virus.
Dr. Gani, let's talk about what NAFDAC has done, adding more vaccines to the list of those approved for emergency use. Do we really need more brands added to our list of COVID-19 vaccines?
Yes, we need it. Nigeria is not in isolation. Even other countries, for us to be able to achieve a coverage about 60–70%, you have to need another brand, because generally there are global shortage of AstraZeneca and another brand. So it's a way of a kind of making sure that we achieve more coverage, more people get vaccinated. Nigeria is not an exception to that. Many other countries, I don't want to mention them, also have different brands, just to see that everybody gets vaccinated with the COVID-19. So I think what Nigeria has done is a welcome development, and we are really happy about it. But initially, I was a bit worried with the Sputnik V, because the belief was that WHO has not, approved it for emergency use. Likewise, the European Medicine Agency. But after, going through some other countries' experience, I realized that it is currently being used in up to about 70 countries. And, the Sputnik in particular belong to the same class of AstraZeneca and Johnson & Johnson. But the advantage it had is that it is not associated with the clotting disorder being witnessed with Johnson & Johnson and AstraZeneca. And I think this is the right time for us to have a local content. Every country are now adapting a system that they feel can work for their own citizens. And I think what Nigeria is doing is actually commendable in that respect. Thank you.
We appreciate your time, Dr. Gemiu Janiu, a public health physician. Thank you so much for joining us on the program.
Thank you very much.